Hey everybody, welcome back to another episode of Facebook Live. We are here today at Carrollwood Day School with sports medicine specialist Dr. Christopher Baker. Dr. Baker, how are you doing?
Doing well, Kyle. Thanks for having me.
Dr. Baker is the official team physician for the Seffner Christian Crusaders. Tonight they're taking on the Carrollwood Day Patriots. So Dr. Baker, today we wanted to talk to you a little bit about common knee injuries. Knee injuries are very prevalent in any kind of sport, whether it's from pivoting or, stopping and starting, overall wear and tear. So what are the most common knee injuries that you're seeing on a day-to-day basis, sports-related?
Sports-related injuries in the knee generally revolve around probably three different things. One being the meniscus. The meniscus is probably the most common injury that we see. The most kind of thought of or talked about probably is the ACL. That's a very popular one that people know. And then probably kneecap or patellar dislocations is probably the third most common.
So what makes meniscus tears and ACL tears more common than other types of knee injuries?
Probably has to do with the type of sports that kids are playing. Most of the sports that we see with injuries related to the knee have to do with twisting and cutting. So the knee gets bent and then the kid twists or cuts, and that squishes the meniscus, which is the cushioning cartilage between the femur and the tibia. And that cushioning cartilage tears and then basically ends up being a tear that we have to take care of. The ACL is kind of similar. The ACL is a ligament that is important when we're in part flexion and twisting. Again, in a cutting type sport, football, basketball, soccer, lacrosse, those types of sports are where we see those the most common.
So do you see less fractures and dislocations? We know, especially in the joints like the shoulder and the elbow, you can see a lot of dislocations. Are you seeing those a lot less?
Well, the kneecap dislocations are fairly common, but a true knee dislocation where the tibia and the femur separate are actually very rare, but they're devastating injuries that usually have nerve injuries and vascular injuries. Those guys are a really hard injury to get over and a pretty bad surgical problem too.
So if one of our football players or, one of our cheerleaders that are walking in the back here, if they injure their ACL, if they have a potential knee injury, from, whenever you run onto the field with the trainer, what's the process from, diagnosing them to treatment to possibly surgery?
Sure. So I think the biggest warning sign of you need to see somebody in the medical field is fluid in the knee or swelling in the knee. There's swelling outside of the knee in the soft tissues. Usually that's going to be like a bruise or a contusion. That's usually like along the tibia or along the shin bone. But if the knee itself looks swollen and it's hard to identify the kneecap itself, that's a pretty bad problem. And that's generally going to mean either a meniscus tear, a kneecap dislocation, an ACL, an occasional fracture. We still do see occasional fractures. Luckily, most fractures around the knee we don't need to operate on. ACLs are typically almost ubiquitously fixed. We will almost always fix those. Meniscus tears are kind of depend on the type of tear, somewhat common to get surgery as well. Kneecap dislocations are a little less common to need surgery, luckily.
And what's the likelihood that, should one of our athletes suffer one of these kinds of injuries, what's the likelihood that they can get back to that pre-injury performance? In other words, will they ever be able to get back to 100% again?
Sure. So, the knee injuries are actually fairly good as far as our ability to fix them and get kids back, and adults as well. The ACL being the most common, again, as far as needing surgery. We've got very good techniques that we can fix those and get kids back to 100%. Even though that knee can become back to 100%, though, the return to play actually is somewhat low. When you look at kind of the news and sports, you see it seems like every kid gets back after an ACL, but it might be anywhere from 40 to 60% of kids getting back after an ACL. The meniscus is another one, depending on the type of injury and the type of surgery that they get. Some of those meniscus will be able to get back fairly easily, usually when we clean out that meniscus tear if it heals on its own. Big repairs can be somewhat more difficult, and then the kneecap dislocations tend to get back very well, both with surgery or without surgery.
All right, you heard it there, folks. Dr. Baker, thank you so much.
Thank you very much, Kyle.
For the folks back home, thank you so much for subscribing to our YouTube channel. We finally hit 1,000. Keep tuning in to Facebook Live. Stay tuned in, and we will stay keeping you active. Thanks a lot.
Go Crusaders.
Go Crusaders.